Hi, this is the trainer tip for the multifidi. So what is the multifidi? The multifidi is a really deep muscle of the back. It's almost like a Christmas tree down your back, if you think of it that way, how the muscles go. And it is one of those muscles that are really involved in our deep stabilizing system. It is a muscle that often shuts down with back pain or injury, and is one that we fail to think about sometimes when we're doing some of our programming. We talked earlier about stabilization in our garage clip, and here I'm going to talk to you a little bit about how do you get that multifidi to fire. What are some cues you could do in your class, or what you at home can do to kind of feel and sense that muscle working? So oftentimes we use something called a tailbone lift, or sometimes I talk about an arching of the back sensation. So I'm going to show you sitting, because if you're sitting on this incline, it helps facilitate this rocking forward and rocking back. More forward is what I'm going to ask of the pelvis. So if I ask Cassie here to anteriorly tilt, which means to take your pelvis and move it forward like you're sticking your rear end out, and then if I ask her to tuck under, this is called a posterior tilt. So I'm going to ask you to sit super tall, and I want you to feel like you really stick your buttocks out. If, as a trainer, what I'm looking for is a lot of back activation, and then slowly come back. Now here, I'm going to ask that you sit on top of your sit bones, or you're going to help them find that neutral position, which is rocking forward and back and finding that midpoint in the motion. And then I'm going to ask Cassie, so I'm going to show you what you can do at home, to put her hand right on her small of her back, like right along your spine. So you're going to feel your spinous process. And you can do both fingers if you want. Okay. If you really arch your back, notice how that feels in your body, and then relax. And now visualize arching your back. Maybe you at home, or you have to do just a hair of an arch, and then slowly relax. The intention is that there's barely any movement. So many times if we tell people to visualize the arch, you'll actually get a little movement. So, and you can tell the truth, but do you feel a difference as you do just little arches?
I do, honestly.
And then slowly back. What you want to feel as a trainer, so I'm going to have you move your hands, is that I'll put my hands here. You ask permission to see if that's okay. And I'll feel, if I ask her to visualize arching the back, and then relax. If I say, I don't really feel anything, then I'm going to say, okay, I want you just to arch the back just a little bit. And then that was too much, because you saw how the movement came from the ribs, and then you're going to come relax. So I want you to think about the tailbone. Just stick the tailbone out just a little, and then relax. And then hold this very steady. Generate from the rear, and then slowly relax. And then one more time. Arch, just stop, and then relax. So what you want them to feel is really deep, and you're going to feel in your body this very stabilizing force. What you'll also see as a trainer is where her movement pattern likes to generate from. I can quickly see if it's more from the rib cage, or if it's from the upper back or low back. I can tell if there's guarding. Oftentimes, if there's, like I said, been an injury, or if anything has happened to that back, maybe there was injury a long time ago, or they're just fearful of hurting their back because their family has a history of it, then they might not want to move anywhere from there, and they tend to move from their rib cage. So that gives me a lot of information of how I'm going to cue her throughout her routine. Even if she's in a class setting, I can still use the cues of allow your ribs to draw back and down, push more from the buttocks, get that tailbone to feel like it's lifting up, so I can help cue all different ways to get different people's needs met. Another way to teach this, because sitting can be really challenging, is I want you to go onto your belly, and let's have your head facing the tower. So, and this is, I give this as a therapist all the time as a home exercise program. This is one of the main things I give, because I want people to start retraining this back muscle. So I'm going to ask you to arch your back. That's tucking under. Everyone does that. And then, see, we didn't rehearse. Now I'm going to ask you to go the other way. Feel like you stick it out. There you go. And then relax. So that's typically exactly what you'll see. So now I'm going to ask you to arch your back again. That's tucking under again. So go the other way. No. There you go. That way. And then relax. So now visualize that arch, sticking your kind of tailbone back. Good. And then relax. And then you can have your head supported and down. You can feel whatever feels the best for you. Now just visualize that arch and hold. I'm hardly going to see any movement, but I'll feel, and you'll feel a deep muscle working. Do you feel anything?
A little bit, yeah.
Okay, it's not big. and then relax. Now feel like you do it again. Visualize that arch, and I can see a hair of a movement. Now I'm going to tell her to hold this and take 5 deep breaths. And there, by adding that breath component in, we're going to talk even more about the breath in another tip, is I'm actually adding a stretch component. I'm adding resistance to that multifidi, which that's part of the stabilization. So I'm going to encourage her to do some breathing here and see, can you maintain that kind of hold in the multifidi, that tailbone lift. Can you maintain that tailbone lift and take a breath is another way to say it. And then relax. I usually say take 5 to 8 breaths. Another way you can tell people, if you're just trying to get them to understand, is have them hold. It could be 3 seconds, 6 seconds, 10 seconds. So this muscle is an endurance muscle. It's more of a type 1 kind of muscle. So it wants to be held for a long time at a lower intensity because it needs to be on a lot throughout the day to help us with posture and stabilization. So in this workout with active rest, we're not necessarily stopping and doing multifidi, and as we'll go further, talk about transverse abdominis and breathing. But it is, as a trainer, a time for you to stop in different poses and maybe cue that tailbone lift so they can turn it on and make sure they haven't just forgotten about it and letting the big muscles take over. For you at home, every now and then, as you start to feel this motion, my first suggestion is practice these tailbone lifts sitting. Lying on your belly. Lying on your right, lying on your left side, lying on your back, sitting to standing. You'll start to notice that there's certain positions that this muscle tends to kind of shut off on, and other positions where it's really easy to feel and isolate. So once you have that sensation in your body, then start to cue yourself internally. Is this happening? Every now and then, stop within an exercise and say, what happens if I feel like I arch my back? And hopefully over time, this action will become more to a subconscious level, and you'll start to get that nice stabilization of the body and that strong core, which helps prevent injury.